Good morning, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Medical Officer of Health, Sam Rogers, our Director of Enforcement, and Darren Rizzi, our Fire Chief and our Director of Emergency Management. I want to start off by extending my sincere condolences to Her Majesty on the passing of her husband, His Royal Highness Prince Philip, the Duke of Edinburgh, who has been by her side for the better part of 74 years. He made frequent trips to Canada to promote his Duke of Edinburgh Awards, which were named in his honour. Our sincere condolences to the entire royal family. I would also like to address the mischaracterization of a decision made by Peel's Medical Officer of Health, which was written about in a recent article. We all share the utmost respect and admiration and confidence in Dr. Lowe. Dr. Lowe has done nothing but try to protect the health and safety of residents of Peel and Mississauga since he took the job at the beginning of the pandemic last year. We are all frustrated. We don't always like the medicine our doctors give us, but we must continue to listen to our medical officers of health. Dr. Lowe can attest that we've had some very heated discussions, and I and my fellow mayors and our councillors have asked some pretty tough questions of him. But through it all, Dr. Lowe has never wavered from what is the right thing to do and always in the best interests of all of our residents. And this is no time to play politics with our health. We support Dr. Lowe and in our continued efforts to manage the pandemic here in Peel. On Wednesday afternoon, the province declared a third provincial state of emergency and announced new measures which include a stay-at-home order requiring everyone to remain at home except for essential purposes, limiting non-essential retail to curbside pickup and delivery, restricting shopping mall access unless for curbside pickup and delivery, and limiting big box stores to selling only essential items, something I've been advocating for, as well as all the mayors of Peel, in fact, since last November. I want to thank the Premier for listening to our calls to change the vaccine framework from a strictly age-based cohort system to a more targeted approach, an approach that now includes essential workers and priority neighbourhoods. I want to remind residents that now is not the time to find loopholes in the rules or sneak in a visit with friends and family. Stay-at-home order, shutdown, emergency brake, lockdown. It doesn't matter what you call it. What is important now is making sure that this is the last time we need to do it. So please, stay home, except for your essential purposes and exercise, and limit your contact with those outside your household to stop the spread of COVID-19. I was very thankful that the Premier found a way to restrict the sale of non-essential items for in-person shopping in big box retail stores. I called on the province months ago to restrict these items in an effort to make the lockdown fair for all local businesses. I know how difficult it is for our local businesses, and they've all had to move online or to curbside pickup once again. But I believe that the restrictions on big box stores will help level the playing field between small and large retailers. I've also been advocating for several weeks for Mississauga and all of Peel to receive more vaccine and be prioritized in the vaccination rollout. Peel continues to be one of the hardest hit areas in Ontario. With 10% of the population, we have nearly 20% of the province's total case count. I'd also like to thank the Premier for announcing plans to vaccinate educators, our teachers, and residents in high-risk congregate settings, residential buildings, faith-based locations, and essential workplaces, as well as those 18+ living in high-priority neighbourhoods. Vaccinating these core groups, especially our essential workers, as I have been calling for, will go a long way to driving down case counts in Peel. I'm hopeful that this will also include our transit drivers who serve the public daily. Booking information for those eligible will be available soon. Please visit peelregion.ca for more information. I'm also very excited to announce that Peel Region has open vaccine bookings for residents 50 years and older. Please visit the Region of Peel's website to book an appointment for yourself or for a loved one. Again, that is peelregion.ca. And if you need help booking an appointment, please call the Region of Peel's COVID vaccination line at 905-791-5202. This is also the number to call if you require assistance getting your vaccination appointment. Adults 65 years plus or people of any age who have transportation barriers can book a ride with TransHelp free of charge to get their vaccine appointment. Again, that number is the same number, 905-791-5202. You must call and book 48 hours in advance before your vaccine appointment. On a personal note, I'm very pleased that my 85-year-old mother, Veronica, and I will be getting our first dose of the vaccine this weekend together. Mom was a little hesitant to get the vaccine, which she calls the jab, when it rolled out for those 80 plus, but now we've worked out her concerns and it's very helpful that we'll do this together. Booking online was easy. I took the first appointments available. I feel both a sense of pride that I'm doing my part and a sense of relief that we're making progress with our mass vaccination rollout and moving through the age cohorts. I encourage everyone, as soon as you are eligible, to go and get vaccinated. The best vaccine is the next vaccine available. Along with Toronto, Mississauga, and Peel, we've been in lockdown longer than any other region in North America. In Peel, our 7-day moving average of cases is 540, compared with 396 just 1 week ago. And this is a 35% increase in our case counts in just 1 week. In Mississauga, we're now averaging 174 cases per 100,000, and that's up from 112 per 100,000 last week. Mississauga's R factor, the most significant indicator of community transmission, is now at an all-time high of 1.34. We are not dealing with the same virus that first began spreading a year ago, that novel coronavirus. The new variants represent almost 70% of new cases, with the B117 originally identified in the UK as the most prevalent. VOCs, those variants of concern, have more severe consequences and are more fatal. VOCs are 2.5 times more transmissible, and you are twice as likely to end up in the ICU and 3 times more likely to end up on a ventilator. This reinforces the need to follow public health measures so people do not spread the virus when they don't know that they have it. COVID-19 is now having a greater impact on younger and healthier people who present at the hospital with more severe symptoms, and hospitalizations are longer. Our hospitals are at capacity. Trillium is at 102% capacity and continues to transfer out patients, as done William Osler, to regions like Niagara, Kingston, and Ottawa. William Osler Hospital has 129 COVID-19 positive patients and 23 in the ICU, with an additional 55 suspected cases. Trillium Health Partners has 102 COVID-19 positive patients and a number that they have not seen since January earlier this year, and 25 in the ICU. Starting Monday, Ontario hospitals are being instructed to ramp down all elective, non-emergency surgeries. Our hospital staff are exhausted. The virus seems to be winning this round. Stricter measures are needed in order to address the new variants, allow our vaccine program time to be effective, and halt this virus for good. We are now in a race between stopping the spread of the variants and getting vaccines into arms. While Wednesday's announcement will have a real impact towards ending this pandemic, there is still need for real-time sick pay leave. We are still forcing people to pick between going into work sick or losing their paycheck. I encourage the federal and the provincial governments to please continue discussions on this very important matter. It has not been resolved. Mississauga residents and businesses have sacrificed so much through this pandemic. I ask that everyone in our community continue to support one another. Please visit the websites of your favorite local businesses or visit mississaugamay.ca, a site that the city has started where local businesses can advertise for free and Mississauga residents can easily find the products and the services they need to make purchases and curbside pickups. If you have a local business, I encourage you to visit mississaugamay.ca to advertise free of charge, and so where we will know where to find you and to support you. And if you are able to, please consider ordering takeout from one of your favorite local restaurants. I encourage you to set up virtual touch points with your family. Call a friend or a neighbor to catch up. And make sure to take care of your own physical and mental health. Hike our trails. Take a walk in your neighborhood. I find that exercise and fresh air help me to relieve stress. I'm confident that if we follow the advice of our health experts, we will be able to keep the variant cases at bay and provide the additional time needed to continue vaccinating residents in our community. Make this lockdown the last lockdown. And now I'd like to invite Dr. Lowe up to the podium to give his update.
Thank you, Madam Mayor, and thank you for your kind support and continued leadership. And good morning, rather. Mississauga's weekly incidence rate for COVID-19 currently sits at 174.1 cases per 100,000, significantly up from 111.6 per 100,000 last week, with test positivity at 10.1%, up from 8.8% last week. I know that many in our community likely felt disappointment, frustration, and even anger at the recent return of the provincial stay-at-home order on Wednesday. I felt a different emotion. Hope. Let me explain. We've seen this playbook elsewhere in countries that have gone before us in receiving vaccines and facing third waves at the same time. They succeeded by following a simple path as their cases surged yet again. Close, vaccinate, and exit. They understood, as we do, that with most of their population still awaiting vaccine protection, that they were not able to vaccinate quickly enough to bring things back under control. So they closed again, once more, to save lives, to prevent hospitals from being overwhelmed, and to prevent lives from being changed forever by long-haul COVID, and gave time to vaccinate more and more people one needle at a time. We've seen this in Israel, where a third lockdown turned into a post-pandemic dawn. We've seen it in the UK, where a gradual loosening of measures after their increasing community immunity has come, promises what their Prime Minister now calls a one-way road to freedom. Their experiences give me hope. Close, vaccinate, and exit, with an emphasis on leaving COVID behind permanently. We've never been so close and yet so far. And to push through to the end, there are two things that we must all do to make the most of the next 4 weeks under this stay-at-home order. As we await our turn for the vaccine, we must continue to restrict our in-person contacts and interactions. That advice has not changed. Stay home as much as possible. Favor virtual and work from home if you can. Limit interactions with those that you don't live with to only the most essential reasons, and when you do, mask, distance, do it outside, wash your hands, and if you are sick, get tested and self-isolate. We also need to continue supporting those who cannot work from home and must do everything to limit their contacts voluntarily as much as we can, taking care of them with unrelenting inspections, better protections, and paid sick days, and vaccination as the opportunity permits under the new provincial prioritization. They need paid sick days, though, crucially, for isolation when sick, for testing if exposed, and for the chance to get the shot when it's their turn. That, of course, also means that the second piece of the puzzle here is when it is your turn, please get your shot. The vaccines are safe, the vaccines are effective. Our experience in long-term care demonstrates this. This week, together with our hospital, Ontario Health partners, paramedic partners, and long-term care partners, we demobilized our integrated response team due to a permanent stabilization of the outbreak picture in our long-term care homes. This is a significant milestone. We have also now delivered over 200,000 doses in the region of Peel, are vaccinating nearly 70,000 residents a week with more capacity coming online, and over 40% of our 60-plus population has been vaccinated. I am hopeful that our mass vaccination clinics will continue to help us move quickly down the age brackets where, together with our hospital partners, we are doing upwards of 10,000 doses a day. peelregion.ca/COVID-19 vaccine has everything you need to know about eligibility and booking. And today, those 50 and over in the region of Peel can book at our hospital sites, and if you live in one of the provincially defined hotspots, at our public health clinics throughout the region. Close, vaccinate, and exit. That's what we need to do. And in so saying, I want to close by acknowledging the outpouring that my office received yesterday on social media. I'm grateful for the support, and I thank you. I know that this pandemic hasn't been easy for anybody, but I've also seen through it all how the only way through this is together. I have been fortunate to be backed by a team, a council, and a community that has stood strong against the unique challenges we have faced here in Peel. And I've counted on many friends and colleagues who have stood shoulder to shoulder with me, fighting COVID in the community and in our hospitals. And while sometimes we may hold divergent opinions, I firmly believe that we ultimately share the same collective goal, which is to draw this pandemic to a conclusion as quickly as possible. So the easiest path forward is unchanged. Stay patient and kind, stay home, stay apart, stay safe, stay the course, and when it's your turn, get your shot. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe. And now I'd like to invite Sam Rogers, our Director of Enforcement, to the podium to provide an update.
Well, thank you, Mayor Crombie, and good morning, everyone. I'd like to begin by thanking all residents in the city for their cooperation over the past year, and particularly during this last lockdown period. Public compliance has been excellent, with the exception of a few small private gatherings. Residents have been great at following the rules. Businesses have also been very cooperative. Over the past 3 weeks, as we moved into a modified lockdown, enforcement staff understood that small retail and restaurant patios would require some time to implement all of the regulations. We put a strong emphasis on education to ensure that everyone understood the rules, and the results were that we issued a lot of warnings, but not a lot of tickets were issued. However, as a result of the new stay-at-home order and the updated shutdown zone, we are now planning to shift back to strict enforcement and redouble our efforts to help stop the spread of COVID-19. Enforcement staff have already commenced proactive inspections of big box stores, and I'm pleased to report that our first inspections have shown an excellent level of compliance. This weekend, provincial inspection officers from the multi-ministry task force will join city staff to continue proactive inspections of big box and other essential retail stores. Moving into next week, Staff will conduct proactive inspections of non-essential businesses to ensure that they are operating by curbside pickup only. We will also be continuing to inspect essential businesses, and our focus will be on their capacity limits, face coverings, and safety plans. As always, we will continue to respond to 100% of all private gathering complaints. Our joint enforcement efforts and partnerships with Peel Health and Peel Police have continued to strengthen and evolve throughout this pandemic. This past weekend, enforcement officers supported Peel Regional Police under their Project Noisemaker and Erase. In total, 63 charges were laid for various gathering, noise, speeding, and dangerous driving violations. We believe that this sends a strong message to street racers that these types of activities and gatherings will not be tolerated in Mississauga. I'd like to thank our frontline enforcement officers, Peel Regional Police and Peel Public Health, for their outstanding joint enforcement efforts. They all have extremely difficult jobs, and their resilience, professionalism, and dedication to the city cannot be understated. Thank you, and I'll hand it back over to Mayor Crombie.
Thank you, Sam, for your update, and now we are ready to take your questions.
Our first question comes from Steve Cornwell with Mississauga News. Go ahead, Steve.
Welcome, Steve.
Hi, Mayor Crombie. How are you?
Hi, I'm very good.
That's good to hear. So Ramadan's starting next week, and I
Tuesday.
guess similar to Easter. And similar to Easter this year. It looks like many are observing kind of a major religious occasion during kind of stricter COVID measures. Last year, of course, Mississauga Council passed an exemption to allow the evening call to prayer. This year there hasn't been an exemption passed. But are you supportive of the evening calls to prayer for this year's Ramadan, given the kind of the severity of the situation we're facing with
Right, so Steve,
lockdown and on religious groups?
Certainly, yeah. I agree there has been a significant impact on our religious groups. There has been no formal request for an exemption this year, and as you know, our existing bylaw is quite generous so that the call to prayer can be, that they can, it can be not used. What's the word I'm looking for? Sorry? Permitted, that's the word, thank you. It can be permitted under the existing bylaws, so an exemption is not required. What we have been grappling with is the capacity limits in the mosques. I know that our bylaw officers have been out to work with the executive teams at the mosque to ensure that we know exactly what 15 capacity is, what the limits are, and I know that they will be respected.
Follow up?
I think that I believe that you're correct in the calls to prayer can be done if they're done during the day, but I believe the bylaws now, they still, for an evening call to prayer, I'm not sure it would catch it because it would be, 7 or 8 o'clock at night. Is it for that kind of specific one? Because my understanding is that the evening call to prayer is the more the more vital one during Ramadan. Would you be willing to kind of consider a bit of a working exemption for that if mosques requested it or wanted to do it during this Ramadan?
Right. So as I said, we have not had any specific formal ask. So why don't I ask Sam to come up and address the situation as well? Thank you.
Thank you for the opportunity, Mayor Crombie. And just to elaborate a little bit on what Mayor Crombie's already outlined. So call to prayer is classified as amplified sound, and all audible broadcasts of faith under amplified sound are permitted up until 5 p.m., 6 days a week, 7 days a week, and the earlier start time, 6 days of the week. It has never been an issue before in Mississauga. Last year, Council did pass a resolution to permit a blanket exemption for call to prayer a little more in the evening, Steve, like you said. This year, staff had recommended that we address it on a case-by-case basis. So we are absolutely prepared to receive requests for exemptions on a case-by-case basis. I can tell you that up until this point, we haven't received a single request for exemption. So that just really says to me this is not an issue. It was certainly, addressed last year and became an issue, but it hadn't before that, and we don't see it being an issue right now as well. So just thought I'd add a little extra context there. Over to you, Mayor Crombie.
Next question.
Our next question is from Ashley Newport from Mississauga News. Go ahead, Ashley.
Hi, Mayor Crombie.
Welcome, Ashley. Hope you're well.
Thank you. Yes, I hope you're well as well.
I'm indeed.
Yesterday at Regional Council, we learned that, although I think that we had known before the province had published which postal codes are considered high-risk neighborhoods that will be able to receive vaccines for people 18 or over. And we know that not every postal code in Peel is on that list right now. And I'm not sure if maybe Dr. Lowe will want to weigh on this as well, because I know that he mentioned at the meeting that he's been advocating for the entire region of Peel to be considered a hotspot. I know it's been early, but has the province responded to that request yet? Do you or Dr. Lowe expect to see a change in the coming days and see the entire region considered for vaccine for people of all ages?
So as you say, it's quite early in the rollout, and in fact, we don't know many of the details yet, even how to register for those mobile sites, those vaccines for 18 plus in the high priority neighborhoods that have already been outlined in the newest framework. So it's a little early to expand it. I think just about every postal code in Brampton is on that framework, not everyone in Mississauga, and we just encourage people who, through their age cohort or through their profession that are recognized as essential, we encourage them to go out and get vaccinated. Why don't I ask Dr. Lowe to speak to whether or not there's any thought to adding additional postal codes to high-risk neighborhoods in the hot zones. Thank you, Ashley.
Yes, thank you, Mayor Crombie, and thank you, Ashley, for the question. I think, I think I made clear at Council yesterday that the province has identified 12 high-priority community FSAs and 13 additional high-transmission FSAs, forward sortation areas of postcodes, essentially. And so these 25 postcodes represent what the province has identified as high-risk neighborhoods. And residents who live in one of those, and you can find the list online, if you live in one of the 25 high-risk forward sortation areas and you are 50 and over, you can book at one of the community clinics today through the provincial booking system. If you are 50 over and you don't live in one of those, you can still book at one of our hospital sites, because the hospital sites are taking all comers from all postal codes. And I do recognize that this messaging is confusing. I also do recognize that, even within the region of Peel, there is significant interconnections between all of our neighborhoods and postal code forward sortation areas. So we do try to continue with our ministry colleagues to figure out how best we can message this, how best we can ensure efficiency and effectiveness in booking into our mass vaccination system, and hopefully to be able to treat all of the region of Peel as one zone, recognizing, of course, that the ministry is trying to prioritize certain hotspots, but that for avoiding resident confusion and messaging of the manner that I just had to deliver, that it may be easiest to just say Brampton, Mississauga, and Caledon, you can book at this age group. Thank you very much for the question.
Next question, please.
Follow up, Ashley.
Oh, Ashley.
Thank you. Yes, thank you. And yesterday also at Regional Council, Council voted in favor of Carolyn Parrish's motion to come up with a Made in Peel mobile vaccination program. Again, I know it's extremely early in that planning process. The motion just passed yesterday. But again, not sure if maybe Dr. Lowe wants to weigh on this as well. But will this program complement the province's mobile plan, which again, we're still waiting on a lot of details on, or will it be used instead of it?
No, it will complement. We're, as you said, still waiting on the details of the provincial program, which employers, which professions, who are essential workers, how do they register, when will it come, etc. All the details. So we are still working out the logistics here in Peel and how it will operate, but obviously this is something that's very important to our council, both here at the city and at the region, that we take mobile clinics up to the hot spots, those large employers where we have seen those outbreaks. We think it's vital that that those essential workers in our factories and our warehouses and our food processing, manufacturing, etc., as well as essential workers like educators are now specified in the provincial framework, our transit drivers, police officers, etc., vital that they all be vaccinated. Dr. Lowe, would you like to speak to mobile units as well? Thank you, Ashley.
Yeah, thanks so much, Madam Mayor, and thank you, Ashley. I think I want to make very clear one thing, that the backbone of our mass vaccination rollout here in the Region of Peel continues to be the system that we have built, the 11 hospital and community clinics that are currently throughputing almost 80,000 residents a day, a week, and will, by the end of the month, be putting through over 140,000 residents a day. That continues to be the most effective and efficient way to get many residents, including essential workers and all the different professional designations and classes that are out there, vaccinated in the least amount of time to get to that community immunity. So I really want to set, an expectation for the community. If you are able, able to get to a mass vaccination site, we're aiming to move down age brackets as quickly as possible. 50 this week, hopefully 45 next week, depending on clinic availability and supply. We'll continue to move down at five-year increments as much as possible, so that by the end of the month we're in the 30s or the 20s. We are seeing tremendous uptake. Usually after we release a 5-year tranche, we are seeing almost 60% of that group get vaccinated within a 5 to 7 day period through our current mass vaccination system. So that will continue to do the lion's share of vaccines in our community. However, both ourselves as well as Council and the province have always been seized with how do you get to the hardest to reach populations. Our mobile modalities have already been in existence since early February. They were used initially to vaccinate our long-term care and retirement homes, and then further proceeded since then to target congregate living settings, apartments and condominiums with high numbers of seniors in hotspot areas, knowing that those seniors still remain at risk and oftentimes are homebound and can't get to a mass vaccination site. We identified 120 such facilities following the long-term care campaign, and we're now through half of them. We have heard the call for additional focus to be brought on workplaces. The original intention was to finish those senior congregate settings and then get on to essential workplaces in line with the province's framework that had essential workers and those that couldn't work from home in May and June. Certainly the opportunity with the lockdown and the change in the provincial prioritization means that we can now try to figure out how we can augment that capacity sooner, and of course welcome any assistance from the province with their mobile program as well. So again, it's all the different strategies that we're throwing at once. The lion's share in mass vaccination clinics, pushing people arms to needles, and then for the hardest to reach group, including our essential workers who are working in those large workplaces, continuing to build up our mobile modalities. Thanks for the question.
The next question is for you, Dr. Lowe, as well. It's from Isaac Callan at the Pointer. Go ahead, Isaac.
Hi, Isaac.
Hey, Dr. Lowe. Happy belated birthday.
Oh, thank you.
Just following up on that last answer, to get an idea of, I know you've talked about the age being the backbone, and the province did sort of mix up their priorities or change their priorities the other day. Just how much of a replanning effort is that going to be for you guys at Peel Public Health, given how many of those priority hotspot postcodes with teachers and then 18+ at mobile vaccination clinics, how much of a replanning effort are you going to have to put into this?
Well, we're trying to make it as seamless as possible, Isaac, and I think to the extent that we're currently in talks with the school boards around how we use our existing capacity to cover off the teachers that have been identified by the prioritization, we are looking to really augment our mobile capacity, and I actually have a meeting with my team this afternoon to understand, we've had a number of mobile units that have been doing these congregate settings for seniors and hotspots, as I mentioned. Do we repurpose some of those to go into workplaces? Do we work with, and we continue to talk with all of our boards of trade, our economic development offices. They've all come to us with plans. We have continued in discussion and dialogue with them. There's not been any foregone conclusions there. And so I think to the extent that, our team is looking to build up and build on the success of our mobile program to date, I'm hoping it will not, we're aiming to make sure that this is as seamless as possible.
Follow up, Isaac?
Yeah, absolutely. And this may be slightly difficult to articulate an answer, but I think it's a question a lot of members of the public have. We're a year into this pandemic, and at every level of government, not just locally, decisions still seem to be being made at rather the last minute. I know that, trends change and you're monitoring them every day, but are you able to really explain and articulate to people why so many of these decisions were announced the day before rather than giving people 1 or 2 days warning, since we're a year in?
Yeah, absolutely, Isaac. I think the reality is that especially when you're in an accelerating wave and an accelerating situation, the situation changes rapidly. In the case, I believe you're probably referring to the school closures, certainly for which I think the the inconvenience I regret. Being a parent myself, I know how difficult it is, and I think the thing I would highlight is of a decision of that magnitude, it took pretty much all of Easter weekend to work with 2 different ministries, 2 different school boards, including one which shares a boundary with another health unit, coordinating with health units across the province and trying to do our due diligence. So you could go out very quickly and make these decisions on a snap basis, but you also have to make sure that in the face of these trends, you're also still doing your due diligence. And I think we got the balance right here in Peel by going out on the Easter Monday before schools reopened, and just making it very clear. Even if it was inconvenient, we did try to get notice to parents as quickly as we could while making sure that we did our due diligence. So thanks for the question, Isaac.
Next question.
Our next question comes from Khaled Salama from My Second Home TV. Go ahead, Khaled.
Thank you. Hi, Mayor.
Welcome, Khaled. I'm very well, thank you.
Great, thank you. I need to ask which level is considered a noise? I mean, how you measure the noise levels, how many decibels?
Noise. Okay.
Yes. How many decibels are considered really noisy and not permitted? And also, do you have any gadgets to measure this on the spot?
Yes, I'm going to ask our Director of Enforcement, Sam Rogers, to come and tell you all about his gadgets and the noise levels and decibel levels. Thank you.
Thank you.
Thank you, Mayor Crombie. Unfortunately, we don't have gadgets. Gal, to answer your question, we don't measure noise decibels today. That was a recommendation that we've kind of deferred for now. So the way we enforce noise today in the city is based on time. We have classifications, types of noise, and we're talking about call to prayer a lot today. That, as I said already, is classified as amplified sound, and that's permitted certain times of the day, so 7 a.m. to 5 p.m., Monday through Saturday. If amplified sound is occurring at that time, it's permitted, and if it's outside of that time, it's not, with the exception if there's an exemption granted. So no decibels today, only measured based on period of the day and time.
And Sam, this is not a follow-up, but I'm just need some clarification here. Thank you for mentioning that you don't have gadgets yet, and I'm not talking about call to prayers. I'm calling about 10, 11 after midnight, very noisy cars, modified mufflers, and complete chaos, and everybody gives the cheek. How and why?
Right. Okay. So that's a much more complicated one. There's a number of ways we enforce vehicle noise under the Highway Traffic Act, and that's historically what Peel Regional Police have used. But recently, we've amended our noise control bylaw and nuisance noise bylaw to strengthen and give Peel Police more tools to have a little bit more of a subjective assessment to the noise. So if it is reasonable to deem it as a disturbance through a modified muffler or intentional squealing of wheels, doing burnouts, that type of thing, that's now classified as unpermitted activity under the bylaw, and with that comes stricter fines. So over the weekend, our team alongside Peel Police issued $385 tickets to some of these car meetups for street racing where they were doing burnouts, had modified mufflers, and were intentionally creating loud noises at nighttime. We know this is a big issue citywide. Council's made that very clear, and under Project Noisemaker, Peel Police are treating it as a priority.
Thank you. My follow-up is for Dr. Lowe.
Yes, Khaled, thanks. Go ahead with your question.
Dr. Lowe, why do we have a very short-lived, shelf life vaccination, and why Canada allows these near expiry dates come to Canada. Yesterday in BC, they gave expired vaccines to Canadians. How and why? And can you clarify and elaborate on that, please?
I can't, Khalid. Procurement is undertaken by the federal government through Procurement Services Canada. In respect of the vaccines themselves, I view it as any other food product. If it's near expiry, it's not expired. And I mean, if I'm being completely honest, sometimes I've done the sniff test for milk in the fridge as well. So, I mean, I think you'd have to ask the federal government that one. But I think if it's near expired, it's not expired. And I can't comment on the situation in BC or on federal procurement policies, unfortunately.
If you get an expired vaccine, doctor, does it affect your health? Expired already?
So, again, Khalid, I can't comment on what occurred in British Columbia. And certainly in the region of Peel, we would not be providing expired vaccine to anyone. I mean, this is something that we would certainly be aware of, and is actually something that has driven a lot of our vaccination campaign in terms of ensuring that we match expiry dates and supply, et cetera, to the demand that's coming through. So, I think it's concerning to me that what you've shared. I'm not aware of it certainly, but I think people are my colleagues where I used to work in British Columbia. My colleagues in British Columbia are excellent. I'm sure they would be able to respond to your question. Thanks for the question.
Thank you. Thank you.
Next question.
That concludes our questions for today. Thank you.
Thank you very much.